Hi, my name is Sarah Lax, and today I'm going to be giving my demonstration speech. Here's my audience. Today, my demonstration speech is going to be about first aid. I actually work as an EMT on an ambulance company called Medic West, and basically we respond to any 911 call regarding any medical emergencies. I've seen anything from choking to seizures to unknown problems. So first aid means a lot to me because I've seen so many times in critical moments where bystanders are able to perform first aid and actually increase the ability of that person to stay alive. So this is extremely important, and it could be used in anyday life. So my first topic is actually not specifically on first aid, but is about safety before you do first aid. Safety means a lot because if you are not safe when you do stuff, then you can actually end up being an extra patient, and you can harm yourself and others in the making of whatever you're trying to do. And so please, if the situation does not seem safe, don't put yourself in harm's way. Okay, now going off of that, we're going to talk about our first topic, which is burns. So there's 3 different kinds of burns. There's superficial burns, there's partial thickness burns, and there's full thickness burns. So superficial burns are your just classic, oh, I touched a hot stove and now I have this little red mark on my hand. So how you're going to treat that is you're going to run it under cool water, and you're just going to wrap it nice and loosely, just so that the wound's able to breathe and that nothing dirt can get in the wound, because your skin, it burns off your skin, and that's your protective layer of covering for your inside of your body. Our second type of burn is going to be our partial thickness burns, which is your 2nd degree, and so that's characterized by blisters. And so you want to do the exact same thing as you did for the first, except you want to lightly wrap it with gauze, even lighter than before, and not pop the blisters. So the gauze for the 2nd degree is actually just to make sure that the blisters don't get popped, so you don't risk infection and anything getting inside the wound. Now your 3rd degree is a lot different. It's called a full thickness burn, and this is characterized by charring of the skin. So it looks like your skin was completely burned off. And so this is different than the others is because there's nothing you can do for this outside the hospital. So what you want to do is when you see this, you will definitely know when this happens, and you would want to immediately call 911, because this person's also at risk of hypothermia, because burn through your protective layer of your skin, which is your skin, and that actually increases your risk of hypothermia. And that is another issue we don't want to have to deal with, so we want to make sure they stay nice and warm, and so that they're able to get to the hospital fast enough, and the hospital will have to deal with it from there. Our next topic of today is going to be cuts and bleeding. I'm only going to cover 2 types of bleeding, and these are the most critical types of bleeding. So there's one where blood is like oozing very, very fast and streaming out of the wound, and that is going to be a cut through the vein. And there's going to be a type of wound where the blood is squirting, and so that's going to be a cut through an artery. And out of the 2, the artery is the most critical one that you want to watch out for. But first I'm going to address the vein. So what you want to do for the vein one is if you have a first aid kit, you would want to grab one of these, which is called a 4x4, or just a little piece of gauze, and this, which is a gauze roll. So what you want to do is you want to elevate the arm, and you want to put as much pressure as you can on it. And if it bleeds through this, then you want to make sure that you put another one on top of it and not take it off, because then that will stop the clotting process. And so after you've done that and you make sure that the bleeding stops, you want to wrap it really, really tightly, just so that the blood doesn't keep going and so they don't lose any more blood. And then you want to definitely contact 911, because losing that much blood is very, very dangerous for you. The second type is arterial bleeds. And these ones are squirting. It looks like a water gun, but with blood shooting out of your arm or any appendage. And so there's a thing called a tourniquet that can help with that. Now tourniquets only work on appendages, so your arms and your legs. So if you have arterial bleed on your arms and your legs, you can do this method. If it's anywhere else, you just want to apply pressure and immediately call 911, because there's no way you can do a tourniquet around any other part of your body. And so for a tourniquet, you want to either if you have a tourniquet on you, great, but not all of us are in that situation. So you want to get a piece of cloth, maybe like this one, or by ripping up a shirt or a belt, and you want to put it above that wound. So you want to put it above it, and you want to do it as tight as possible until blood flow stops. This is so that the artery is cut off so you can't lose any more blood, because within 3 minutes of an arterial bleed being untreated, you can actually die of blood loss. Our next topic is going to just be quickly covering CPR. So I'm not going to go into logistics of CPR because we all know CPR gets little complicated based on age, based on situations, based on anything, and rates and everything. So I'm going to just teach the most basic way how to do CPR. So what you want to do is you want to cup your hands, and you want to put this right in the middle of their chest. And from there, you want to just make sure you push hard enough down on their chest. They either get cracking or you go down about 1.5 inches on an adult, and so that you're able to reach the heart and pump the heart. Now this is used in any situation where you don't think that there is a pulse or that there is no pulse. And so you just want to go hard and fast on that one just to make sure they get blood throughout their body. So this means a lot to me, and I know I said this at the beginning about going through experiences where first aid comes in handy because I've seen a medical emergency myself. And so I'd rather know that, if I would have had this knowledge back then I would have been able to help save someone's life. But instead, I learned the hard way that CPR and first aid is very important. Thank you all for attending my speech. This is my audience again, and this is going to be my note card.